Next, we have Dr. Thomas Pfeiffer with Integrative Oncology, Other Options. Dr. Thomas is going to have a translation, so
Dobré odpoledne vám všem.
Good afternoon to all of you.
Jmenuji se Tomáš Pfeiffer a jsem ředitelem Institutu pro TCIM.
My name is Tomáš Pfeiffer and I'm the director of the Institute for TCIM, and I feel really honored to have the opportunity to speak to you at this Congress. I would also like to introduce Ms. Markéta Lacikova, who will be interpreting this presentation. At the same time, I would like to thank Dr. Ana Moreira for inviting me here. The last 100 years of intensive cancer research, despite all the achievements in extending the life expectancy of patients, have not brought a full understanding of the nature of cancer pathogenesis. Meaningful, comprehensive cancer prevention programs haven't been fully developed yet, as evidenced by the fact that cancer incidence is currently on the rise. Conventional medicine focuses almost exclusively on the destruction of the cancer cell, which it sees as the cause of the disease. However, removal of the tumor is only a salvage treatment, not a causal treatment. And therefore, unfortunately, successful treatment is often followed by recurrence. It is difficult to find an understanding of the nature of the cancer process and the body of knowledge from different perspectives. This may also be due to the fact that we are searching in a place where the basic solution is not found. Now allow me to present you with a new view of the tumor process based on the findings of biotronics, which is a new field of energy therapy founded in Prague by Josef Zazulka. Firstly, a tumor cell is not a cause in itself. It is the result of a complex disease, often arising long before the first tumor cell. Let's think about the malignant reversal of a healthy cell. The common characteristics of the cell of different types of tumors justify why we can assume that there are not dozens of types of malignancies, but only one process affecting any one cell of the body. And now let's look at a tumor cell and its specific features. There is a fundamental change in the morphology of the cell. The mechanisms controlling the growth and metabolism of the cell are disturbed. The cell does not engage meaningfully in bodily processes. The formation of an uncontrolled, chaotic vascular supply eventually leads to tumor disintegration due to ischemia with often inflammatory and toxic consequences for the organism. Tumor cells often grow several times faster than healthy cells. This drains the body's resources, hence fatigue and weight loss in some patients. In contrast to healthy tissue, the bond between cells is weakened. So tumor cells are more easily detached and travel by blood or lymphatic channels, forming a metastatic process without growth control. The tumor cell is a typical parasite deserter that uses the body's resources but contributes nothing to the body. It originates from the body's genome, therefore it is not registered by the body as a foreign tissue and is often not visible to the immune system. The behavior of a tumor cell is determined by its type and location, not by the body's regulatory mechanisms to which it does not respond. Now we need to ask an important question. What leads to a malignant reversal? The first and main factor is the presence of a carcinogen, a cellular poison of a chemical nature, acting on the nucleus of the cell, which it reprograms. At the point when the body's main detoxification organ of chemical balance, the liver, fails or is overloaded, the nano level of carcinogen in the body rises. In addition, various substances and influences further synergize and its transfer across the membrane into the nucleus of the cell. For example, alcohol, microwave radiation, any other radiation, overall weakening of the body, genetic factors, any irritation and other stresses. Recently, a lot of attention has been attracted by the WHO research demonstrating that processed and red meat is carcinogenic. Carcinogens can be divided into primary and secondary carcinogens. Primary carcinogens, which are real cellular poisons, typically tar, benzoic nuclei, and others. After tumor formation, even minute amounts of these substances are toxic. That's it. Now, let me show you an anti-cancerogenic diet developed by Josef Zazulka in Prague. Firstly, what is prohibited? Smoking, of course, but also anything which is smoked. For example, smoked meat, salami, ham, smoked cheese. Also, decoctions of roasted things like coffee, very popular, right? Cocoa, chocolate. Also, anything that is fried. Baked food is not suitable either. If you need to eat baked food like bread, cut the crust off. Also, avoid tins containing benzoic acid. And anything containing tar, naturally. Now, let's look at the things which are recommended on contrary. Fresh fruit, vegetables, milk, butter. There is a basic rule. If food is cooked in the kitchen, it should be only boiled or stewed, which means that food should contain water. This is very important. This diet has to be followed strictly because oncological patients are already hypersensitive to all these substances. This diet is not a curative diet itself. It's just a sparing diet which conditions the treatment. Now let's look at secondary carcinogens. They are not chemically active, but accelerate the metabolic activity of the cell by irritating it, increasing the concentration of the carcinogen. A typical example is asbestos. In asbestos, chemically neutral needles of the mineral irritate the cell, which then accelerates the uptake of the primary chemical carcinogen. In other cases, parasitic, viral, fungal, or bacterial infection is the locus of tumor formation, in which case it is also predominantly a secondary carcinogen. Any inflammation, any irritation of a healthy cell, typically by solar radiation, non-carcinogenic chemicals, under the condition of impaired morphogenetic synthesis and detoxification function of the liver, may also lead to tumor formation. formation. 12. The second important factor in a tumor formation is damage to the morphological centers of the body situated in the brain, which, in addition to the genome, are responsible for the shape and location of cells and tissues. Damage to these centers signals the presence of benign neoplasms, keloids resulting from trauma, faulty cells, differentiation, and so on. This condition can be termed pre-cancer, which is normal cells in the wrong amount in the wrong place. 13. And now let's look at the biotronic intervention in tumor processes. After 1945, Józef Zazulka formulated the field called biotronics in Prague. Biotronics is based on the intervention of biological forces transmitted by the therapist. He described the tumor process and the method of acting on its causes. In the most difficult conditions, he repeatedly achieved remarkable results in the field of oncology and other diagnoses. Every experience is significant to our knowledge if it goes beyond ordinary clinical experience. A few case reports support this message. And now let's look at the most interesting case reports. Let's start with a 52-year-old woman who suffered from a large inoperable stomach adenocarcinoma in the terminal stage. Nearly half of the stomach was infiltrated with a solid tumor, and duodenum was infiltrated as well. I need to highlight that no medical intervention was carried out due to the stage. And this patient decided to undergo biotronic treatment, and after that, an encapsulated tumor was found, and the patient lived for more than 23 years after the initial diagnosis had been given. The second case reports a woman who was 70, and she had a small cell bronchogenic carcinoma with metastasis in her mediastinal and throat nodes. Chemotherapy had to be discontinued due to a bone marrow reduction. This lady also underwent biotronic treatment, and she lived for the following 14 years after the initial diagnosis. The next case report is about a 53-year-old man with a malignant left lower limb melanoma, which was progressing locally. Metastasis was found in the pelvis minor as well. Unsuccessful oncological treatment was carried out and terminated. And then he decided for biotronic treatment. I must say that the patient is still alive, and he has been living for 22 years since the initial diagnosis. 17. Now let's move on to a case report on a 35-year-old woman with an ovarian papillary adenocarcinoma. This lady had undergone 3 different types of chemotherapy and other supportive treatment, but despite all that, there had been a significant progression of this tumor in the lesser pelvis and abdominal cavity up to her umbilicus. Then she underwent biotronic treatment, which lasted 2 years and a half. And after that, multiple examinations were conducted. These were CT scans, sonography, and scintigraphy, which showed an improvement of her health. And it led until the complete regression of the tumor. The patient is alive, and it has already been 36 years since the diagnosis had been given. Now we are going to look at the case of a man at the age of 44 who was diagnosed with a lentigo melanoma, malignant melanoma, of the right nasal wing with the initial size of 7 by 4 millimeters. A surgical extirpation of the tumor was recommended. However, after taking a tissue sample for a histopathological examination, the tumor began growing intensively to its maximal size of 10 by 8 millimeters with blurred edges. And we're continuing with this case. So this patient was offered biotonic treatment, which was offered while waiting for the surgery. And the biotonic treatment reduced the tumor to size to 7 by 7 millimeters and sharpened its borders. Afterwards, a less radical plastic surgery than originally planned was performed. And biotonic treatment continued also after that surgery, and the patient is still alive. It has been 11 years after the diagnosis, and additionally, his face shows no trace of surgery. He recovered completely. We are finding ourselves close to Fatima, which is a place of miracles. And I believe that the following case, which has been fully documented, belongs there. That's it. The most striking result in biotronics was observed in the case of a stomach carcinoma in the terminal stage. Let me highlight this. An overall revitalization was achieved after 7 days of biotronic intervention. And now the most surprising fact is that the artificial duct in the abdominal cavity after colostomy healed up spontaneously without a surgical intervention. Such a result of a non-invasive intervention is not yet known in the medical literature. The practical results of biotronics suggest the correctness of understanding the tumor process as a degradation of the function of the liver and the morphological centers of the brain in terms of biological forces. In practical treatment, it represents a new procedure not yet explored in medicine that awaits serious interest from oncologists. Our ancestors used to call cancer morbus Prometheus. The moment people started using fire, they put a strain on their livers. As mentioned before, it is the impairment of the detoxification function of the liver that is one of the causes of cancer. Excessive pyretic changes in the diet are to blame here. The symbol of the eagle destroying Prometheus' liver is thus ingenious. Let me conclude by saying thank you to Dr. Ana Moreira for organizing this extraordinary congress. And at the same time, I would like to thank you for your attention. Have a nice evening.